Today, I'll be talking about a mental illness that is closely tied with something that brings so much joy to families. And what I'll be talking about today, can you guess? Oh, okay. It's postpartum depression. Now, postpartum depression is a mental health problem that affects about 1 in 5 women globally. It often occurs immediately or a few weeks after child delivery. In Yoruba, it is called abisinwi, which is a form of derogatory word that is used to describe a woman that develops a mental health issue following child delivery. But postpartum depression is a mental illness that could affect any woman. And it's something that we should give much attention to because oftentimes it is misunderstood. Sometimes the woman may be termed lazy or could be said to be pretending. Sometimes it could be said to be a spiritual attack, something that affected the woman, by a diabolical means or things like that, which are not very accurate perception of what postpartum depression is. So let's see what characterizes this illness. What are some of the symptoms that we look at or that we notice in a woman who has just given birth that may help us consider or think that this woman may be having this mental health illness that we are talking about today? Number one, we know that a time of child delivery, when we have a baby in the house, it often comes with joy. But this woman experiences enduring feelings of sadness. She has uncontrollable tearfulness, weeping spells. There's a loss of pleasure in the things that she usually enjoyed doing. Lack of interest even in friends, lack of interest in the baby, lack of interest in things generally that's happening around her. This woman may have difficulties sleeping and may even have a significant change in appetite. Some may not even feel like eating at all, while others may eat too much. There could also be irritability, easily getting angry, being overly anxious about her ability to actually take care of the child. There's a feeling of agitation and difficulty experiencing being able to concentrate on what's happening or on tasks at hand. There's also this feeling of exhaustion, unexplained exhaustion and tiredness, feelings of hopelessness, feelings of guilt, or a sense of worthlessness that may come with that this woman may experience or may even verbalize. And then there's that feeling that I'm not a good mother. The loss of confidence in the ability to actually take care of the child. And sometimes the woman may actually be having thoughts of harming the child or fear that the child is not safe with her. She may also be having thoughts of harming herself, thoughts of death, or thoughts of committing suicide. And so by the time we notice that a woman who has just delivered is withdrawn, keeping to self, is not her usual self in terms of mood, it's a red flag. And we need to pay close attention to this. Sometimes these symptoms may even occur during pregnancy and may climax maybe after giving birth. And for the woman, there may be this feeling of not being sure of what is happening. There may be a feeling of shame that how can I, a mother, be feeling like harming my own child? Be feeling like strangling my child? Why should I hate my child so much? Why should I not want to take care of my child? There's that feeling of guilt and shame that a woman may experience when she's going through this, and it can be very frightening. And this shame may also contribute to her not even wanting to talk about her feelings, because she doesn't want to be judged as a bad mother. She doesn't want to be stigmatized with a mental illness. And this, could keep her from talking. But every mother that has is experiencing this, or may experience this in the future, should realize that having these feelings, having this experience of postpartum that we just described now as postpartum depression, does not mean that you are flawed. It does not mean you have a character flaw. It does not mean that you are lazy. It does not mean that you are weak. It does not mean you are incapable of being a mother. It is an illness that is treatable. And as such, you do not want to hold back from doing the needful, seeking help. And it is not an illness that you could just say, I will snap out of it. You need treatment. That woman needs treatment. And she should not be ashamed or made ashamed of this condition. It is treatable. If not treated, the child and the mother are at risk. And so it's important that this woman, especially when it is noticed, this woman should be taken to the hospital for help. But let's also look at what are even the risk factors for having a postpartum depression. One of the important risk factors of having a postpartum depression is having a history of mental illness, especially a history of depression or a history of bipolar disorder. So having a history of mental illness is a risk factor for postpartum depression. Also, if in previous pregnancies, this woman has experienced postpartum depression, there is a likelihood that she may also experience it in another pregnancy. So it's important that these risk factors are known, and they can be used as a guide to, and when this risk factor is there, you want to also let your medical practitioner know about it, that you have a previous mental health challenge or a previous postpartum depression in an earlier pregnancy. And then if there's a mental illness such as depression in relatives, blood relations, then it's important that this is a risk factor. There's a likelihood of experiencing postpartum depression following delivery. Then the lack of emotional and social support from families and friends, family members and friends, is also a risk factor for having postpartum depression. Furthermore, when there are difficult life events, stressful life events, adverse life events that occurs during close to the time of delivery, then this woman may be susceptible to postpartum depression. And so as much as possible. And then when there is marital conflicts, when the husband and the wife are not in, when their relationship has a problem, when there's an interpersonal relationship or marital stress, this could also predispose a woman to postpartum depression. Then another risk factor could be certain antihypertensive medication that a woman could be using or could have been prescribed for a woman either due to preeclampsia in pregnancy that should be avoided following birth. And so it's important that even when a woman is on an antihypertensive medication, she should show this to her doctor to be able to tell her if it's safe for her to use after delivery, because certain medication may predispose a woman, especially the one called methyldopa, may predispose a woman to developing postpartum depression after child delivery. And then there are also protective factors. And one of those protective factors is having your mother or your mother-in-law come stay in after birth. I know that these days, mother-in-laws can be very busy, because especially when you have mother-in-laws that are maybe entrepreneurs, mother-in-laws that are civil servants, mother-in-laws that are busy. It can be very difficult to have these mother-in-laws come to stay with the woman that has just delivered. But this is a very important protective factor. People to be around the woman to help care for this baby, and care for the mother also at this point in time, because the time immediately following child delivery is not often a very easy time for women. And some people may just think, she's a woman, automatically she should be able to cope. But it is not so for everyone. The way women are able to cope during and after pregnancy, after child delivery, differs. And we cannot just assume. No, rather, let's, fall back to our cultural system, we call omugo, where mother-in-laws are available to take care of their daughters and the baby at immediately after delivery. And oftentimes they stay like as long as 6 months. And then the husbands too could also be a protective factor. A sensitive husband, a husband who is domesticated, who is able to cook, to support the woman in a whatever way, who is sensitive to her emotions and looks out for her, is also very important. Friends too can come around to help the woman at this point, to help reduce the stress of that's around this pregnancy and delivery period. This would go a long way in helping this woman deal with these issues. And so what are the treatment options? Medication, pharmacotherapy. There are different medications, and so in such a case, there's a need for a psychiatrist, to examine this woman and to prescribe medications. And for the woman, she just needs to be patient with some of the medications because they may not start acting fast. And also, some of these medications have side effects that the woman should know. For instance, it could have caused dryness. Some may cause dryness in the mouth. Some may lead to increased weight, the gaining of weight. And some other side effects, reduced libido, sexual dysfunction, or other side effects. But irrespective of the side effect, it's important that she discusses the side effects with the psychiatrist before going off the drug. Some experimentation may be made in choosing drugs for her until there's one that is working perfectly for her. Apart from medication, there is also psychotherapy. Psychotherapy is a form of talk therapy where a counselor, a psychologist, a clinical psychologist, or a mental health care professional, even a social worker could, have sessions with the woman about her challenges and all of those things that to just help her in cognitive restructuring, in problem solving, that could help deal with help her resolve those symptoms in the postpartum depression. And one other treatment that cannot be gainsaid is that of emotional and social support from her immediate family system. Let us look out for these women so that they can access the proper care that they need, so that their children can be well taken care of, and so that we can have a better society for every one of us. If you have questions you like addressed concerning postpartum depression, please feel free to share your comments, to put it in the comment section. I would really love to hear from you. See you next time. Bye.